Have you ever come across the term cornea transplant or its medical term keratoplasty? Have you ever wondered who would need the surgery and where do they get the graft from? Or how long does it take to recover from the cornea transplant surgery? In this video, I will touch base on all your inquiries about the topic of cornea transplantation, who needs it, and what is the expected recovery time. The cornea is a clear dome-shaped lens in front of your iris, which is the colored part of the eye. It is the first lens that meets the light entering the eye so that its integrity and clarity are essential for the accurate vision and the accurate image that's focused on the retina. Certain diseases like corneal ulcers, keratoconus, and deep corneal endothelial cell diseases cause opacities and irregularities of the cornea. This leads to high astigmatism and light scattering, which cause image distortion and blurring of vision. These diseases need corneal tissue replacement through a procedure called corneal transplant. And this is done by removing the diseased tissue and placing clear, healthy corneal tissue from a deceased donor. There are different types of corneal tissue transplant surgery depending on the level and the depth and the amount of corneal tissue to be replaced. The two main types are the partial thickness graft or lamellar keratoplasty, or the full thickness or penetrating keratoplasty. In penetrating keratoplasty or full thickness grafts, the entire corneal depth is removed and replaced by a congruent graft, which is then placed carefully and sutured with utmost precision. This is done by fine sutures that are removed several months later, and the removal is done after complete healing of the graft. On the other hand, a lamellar keratoplasty or partial thickness cornea transplant is simply replacing either the outer or the inner corneal layers depending on the diagnosis and state of the eye and patient's general condition. In inner corneal transplant, or DMEC as it's formerly known, no sutures are required and it is considered a sutureless procedure since we inject air inside so that the internal graft is kept in place. While in the outer cornea transplant, for example, deep anterior lamellar keratoplasty or penetrating keratoplasty as they're better known, sutures are required to keep the graft in place until it's fully healed. Both penetrating and lamellar keratoplasty can be done by manual dissection of the tissues using surgical instruments or by the use of the femtosecond laser technology to create cuts in this graft and host tissue, and this creates a more congruent donor graft beds for more accurate tissue placement. So, which procedure has a shorter recovery and healing time? In general, lamellar keratoplasty with its subtypes have a shorter healing time with higher success rates and lower complications when compared with the penetrating or full thickness grafts. This is because lamellar procedures have a smaller volume of donor tissue and the eye is not fully opened as in penetrating keratoplasty. The lack of sutures in DMEC, descemes membrane endothelial keratoplasty, decreases the chance of the immune system recognizing the donor graft tissue and hence improves the graft survival rates and visual results, with patients returning to their jobs and their hobbies within a few weeks in this kind of surgery. So how long does it take to see clearly after the corneal transplant? In both procedures, the final visual outcome cannot be fully assessed until the sutures are removed and the residual astigmatism is treated, but the surgeon's experience and surgical skill determines the amount of astigmatism caused by the sutures, and so the more experienced the surgeon, the better and the smoother the visual recovery.